I think mental health is one of those is at the forefront of our community and a lot of these issues. And I think a word that gets thrown around so often is intersectionality. And I think people often just use that word broadly, but to me, it means how like our differences are able to combine and how our differences result, in perhaps more discrimination or more privilege between one another. I think our mental health is often as a result of problems in life, and those problems can be compounded by our intersectionalities because we might be facing more than one issue at once, and because there might be perhaps more systemic bias, for example, towards a young person who is also a person of color and also a woman, right? So I think intersectionality plays a key role in mental health, and it's also really important to understand how those intersectionalities affect your mental health and to sort of break down your understanding of these person's issues as you sort of comfort them and support people who are perhaps not feeling so well right now, and to understand those intersectionalities and how they play into their mental health, right? I think this sort of also leads into the relationship between education and mental health. Education is so important in terms of being able to understand these people, because without understanding the root of their problems, we are unable to empathize and actively listen and to identify what they're feeling and how to best sort of resolve that and comfort them, right? So it is more than just perhaps a person feeling depressed. It is maybe a person is feeling depressed because of a conflict going on in their home country, which is as a result of, ethnic discrimination, right? If you're able to understand those problems and to be educated about that, you're much better able to discuss mental health and some of those issues. And that's really important into creating a dialogue and to able to support your friends and family or whoever else it is, right? I think a key problem, especially that education is able to solve, is that the stigma and the vast amount of language and barrier to entry into sort of dealing with mental health. I think there's sort of this preconceived notion that, you have to be a therapist or you have to be a counselor to sort of help people and to improve your friends. But I think that's simply not true, right? People tell you that, you have to do mental health first aid, that you need to understand all these big words and to understand like the symptoms and surrounding background between these things. I think it is a lot more simple than that. And especially when it comes to youth, we sort of intuitively understand each other perhaps a bit better than other demographics. And it is that we need to make a conscious effort to try and listen, to try and remove and demystify some of those languages surrounding those issues in mental health. Because it is that language sometimes that really creates that barrier to entry. So perhaps, if I had a magic wand, I would try and make discussions around mental health less taboo, to make it easier to access and to make people feel empowered so that they can talk about their mental health freely with other people and to give that support that other people can, receive. So that's sort of my brief thoughts on mental health and some of my ideas that I would have loved to share as part of the National Mental Health Panel. And I hope that you'd be able to attend.